Alright, in this first video, I'm going to be talking to you about the path of blood for deoxygenated blood. So you're going to need to sketch this diagram, so you can pause the video now. It does not need to be perfect. You'll see as I go through like how I utilize these different parts, and that will kind of help guide you. I'll also provide a printable version of this diagram if you are able to print it instead of drawing it in your lab notebook. Okay, so first let's talk about a few important terms. So I mentioned that I'm going to first discuss the deoxygenated blood. This D part, this prefix, should indicate to you that it means it's without. Okay, so no oxygen. Without oxygen. So why would blood not have oxygen? Well, if it's already been transported throughout the body and the oxygen was already transported to the tissues, it needs to make its way back to the heart so that it can get to the lungs to get oxygen. Whereas oxygenated blood has oxygen. And instead of trying to memorize your way through this, you can just think about it logically. Deoxygenated would need to be making its way to the lungs to get oxygen, and oxygenated blood must have already gone to the lungs and got oxygen. Okay. Two other terms that you need to know are arteries and veins. We won't really talk too much about capillaries at this point. Capillaries can allow us to have gas exchange, as well as water can move through them and glucose and things like that, but we're just going to focus on arteries and veins for right now. So arteries, a lot of times people want to say arteries carry oxygenated blood and veins carry deoxygenated blood. That is not always true. So what I want you guys to remember about these is arteries, we've got this A, moves blood away from the heart. Okay. Veins move blood towards the heart. So if you can remember artery away, then veins will be towards. Okay, so that's the first part I want you to understand. Okay, so what we're going to do is we're going to slowly go through and label and discuss the path of blood for deoxygenated blood. This is blood, again, that doesn't have oxygen. It needs to make its way to the lungs. Then I'm going to instruct you guys on how to practice that, and once you've mastered that and you memorize it, then we can move forward to the oxygenated blood. So, the place so blood's going to be coming from somewhere in the body, either in the upper part of our body or the lower part of our body. So, let's say we're coming from the upper part of our body. If that's the case, then the blood will come in right through here. If it was coming from, maybe, I don't know, say your urinary system, it's going to come from the bottom. Okay? So this one up here is called the superior, I'll zoom in, vena cava. Superior is an anatomical term that means above. So if someone's superior to someone else, that means they're like above them. And if we're coming from the bottom, it's called the inferior vena cava. Unfortunately, I don't have a three-dimensional demo right here with me, a model to show you guys. But both of these, so this is going behind the heart. Both of them are going to go into this chamber. Okay, so this is going behind here, and it's going to enter back here. Okay. So if you were to flip this around, you'd see that this tube goes directly into here. Okay. So the blood is traveling through. I'm going to show the arrows to show the direction. Okay, and remember this is going behind. And it's going to end up in our right atria. And some of you right now might be saying, what? That's on the left-hand side. Well, remember that we're looking, think about it as we're looking at somebody laying on a table, right? You're the doctor, you're looking at their heart. Their right-hand side is opposite than yours. Okay, so imagine this is a body laying on the table. Go, oh yeah, that's right. That would be their right-hand side. Okay, so it goes into the right atrium. And it's going to make its way into the right ventricle. Okay, and you can remember that because A comes before V in the alphabet. Now, there's a really important component here that I just skipped. I'm going to draw these arrows anyways. We want blood to continue flowing in one direction. We don't want blood to come back and go into the atrium because we need that blood to make its way to the lungs. So how do we prevent that from happening? Well, we have something called valves, and I'll write that over here. Valves keep blood moving in one direction. Okay, so valves are going to keep the blood moving in one direction. We want the blood to only go from the atrium to the ventricle. Okay, so there's a valve right here, and I'm going to draw it as a little V, showing that the blood's going to move just going through this way. Okay. And this valve right here is called the tricuspid valve. So that's TRICUSPID valve, tricuspid valve. And when we think about the path of blood, we usually think about deoxygenated first, like we've got the blood that needs to go to the lungs, get oxygen, and then go out to the body. So one thing that's going to come in, it's going to come in handy for the next video, is if you remember, try before you buy. So that's kind of like an old saying, like you want to try stuff before you buy it, right? And that's going to translate into our cuspid valves. So this is going to translate into tri, as in TRI, and then when we do the oxygenated blood, bi will be BI. Okay. Okay, and it's, if you were to actually dissect the heart, which hopefully you guys will get the opportunity to in the near future, we could see why it's called tricuspid valve, because of there would be three pieces there. All right, so we've gone in through one of these vena cavas, both go to the atrium. We move through the tricuspid valve, which is important because we want blood to flow in one direction, into the right ventricle. And remember, we can think A, V, right? It's alphabetical. Then the next valve is really nice because it's really easy to remember because it tells us where we're going to. So after we made it to the ventricle, we want to get out to the lungs. And you'll notice this vessel right here goes two directions, right? Why does it go two directions? Well, we have two lungs, right? We have our right lung and our left lung. So the valve here, I'm going to draw it going this way, right? Because we're trying to get the blood to go this way. I'll go ahead and draw those arrows. This is called the pulmonary valve. So pulmonary, you should think lungs. So this valve right here is called the pulmonary valve. Because this is the valve that's having us make our way to the lungs. Okay. So the only tricky one was the tricuspid and bicuspid, which we'll talk about in the next video. Okay, so now let's say you can't remember what this part is. So it's going to be pulmonary something. Pulmonary what? So now we're going to be taking this blood and moving it to the lungs, which are on these sides right here. So would this be, oops, I did not mean to write valve there. Would this be the pulmonary artery or the pulmonary vein? So are we moving blood away from the heart or towards the heart? I'm not sure why I drew it there and then I wrote it there. It's kind of odd when you're like talking and thinking and writing. Okay, anyways, we've got pulmonary, it's either artery or vein. And hopefully you guys are all saying it's pulmonary artery because we're moving blood away from the heart into the lungs. All right, so I'm going to go through and I'm just going to quickly, assuming this highlighter works, highlight the names of the structures. Okay. All right, there's our superior and inferior vena cava. That's where we start. Then it goes to the right atrium and the right ventricle. And between that it went through the tricuspid valve. Then we go through the pulmonary valve to the pulmonary artery, and then this would be out to the lungs. And you can feel free to draw them in if you'd like. I'm not going to do that. It's going to make it really ugly. Okay. So what I would like for you to do is you're going to, actually I'll show a blank diagram for you. Keep your notes in front of you to start. And looking at this drawing, I want you to start tracing the path of blood. Okay, it goes from the superior or inferior vena cava to the right atrium, through the tricuspid valve, through the right ventricle, and so on. So you can try to do that using your notes, okay? And you can just pause the video and look at this diagram to trace it. Okay, so if we're in person, I would have giant diagrams written on the table. I'd mark them in chalk outside, and you'd walk the path of blood. But we're going to have to be, it's a little bit, do things a little differently, obviously, this year. So just keep trying to go through this and see if you can do it without your notes. Because what's going to happen is on your test, it's going to be a timed test, so you won't have time to look up the answers. You're going to need to kind of memorize them. Okay, so go ahead and pause. Try to use your notes up first. Try to trace the path of blood here, stating all the parts of it, including the valves. And once you think you've got that down, try to do it without your notes.